My name is Ramesa Pervez. I'm a youth research assistant at Minds, and today I'll be talking about one of our projects titled Safe and Accessible Transportation for Rural Youth in Mental Health Crises, a Minds social innovation initiative. First off, what is Minds? The Mental Health Incubator for Disruptive Solution of London-Middlesex is a social innovation lab that uses collective impact framework to strategically develop and evaluate high potential interventions that tackle the complex problem of mental ill health and addiction in transitional age youth, which are individuals from the ages of 16 to 25, also referred to as TAY. As part of the collective impact framework, Minds engages and innovates directly with key community stakeholders through yearly convenings, including mental health organizations, clinicians, researchers, and most importantly, youth. In the most recent convening in 2019, hosted by Minds, youth highlighted the inaccessibility and varied barriers to mental health services for youth living in rural communities. So the idea for this initiative was brought forth by youth at the convening and then was further cultivated by working groups that consisted of representatives from the Middlesex County Libraries, CMHA, Star Taxi, and Minds. Currently, there are limited transit options for TAY in mental health crises from rural Middlesex to London, where majority of the mental health services are located. The options that are available have their own added barriers. There are limited bus routes and bus times. It's expensive to take the taxi. Individual can ask their parent or guardian for a ride, but that also means disclosing their situation to them, which youth may not feel comfortable doing in this time. The initiative aims to address this existing gap in mental health services for youth in crises by providing youth in rural areas with free and safe transportation to support services in London. So in collaboration with our partners, we hope to ease the barrier of accessibility and provide youth with the opportunity to access services when they need them, not hours or days or even weeks later. For the purpose of the pilot, the taxi company is serving areas in Lucan, Park Hill, Strathroy, and Exeter. We kept the reach to those specific areas as we have limited funding, which means we have limited number of rides that we can compensate. So how does this initiative work? So if you can refer to the graphic on the slide, you see that first, youth in mental health crises will connect with CMHA's Reach Out 24/7 line, either online, via live chat or over the phone. They will then be supported and assessed by the crisis line staff. If it is determined that a visit to the London Crisis Center is needed, the CMHA crisis worker will ensure a smooth transition from the crisis line to the Star Taxi service. The youth will then be provided with free transportation to and from CMHA's crisis center located in London. To ensure the safety and well-being of the youth accessing this service, Star Taxi drivers have actually received training in crisis de-escalation, mental health literacy, and suicide prevention. So I'll now talk about the methods that were used and the results we have so far. So the concept of this initiative was ideated by youth at the Minds convening. It's a project for youth developed by youth. Keeping with the social innovation approach, the development of the prototype is an ongoing, iterative, and collaborative process. We worked with our partners, so CMHA, Star Taxi, and Middlesex County Libraries, to launch the pilot in 2020. We're also collecting data. So currently, demographic information of users will be collected, such as age and location upon arrival at the crisis center. Youth users will also be asked to elaborate on their personal experience of the service. So how comfortable they felt, if they felt safe, and if they felt supported. And that'll be done through an online survey provided during a follow-up assessment completed by CMHA's Crisis Center. And as of now, the pilot and evaluations are ongoing. There has been limited usage so far, which was to be expected due to COVID-19 restrictions. So for our next steps, we hope to adapt the program to better reflect the feedback collected through the survey on impact and usage. We anticipate expanding the reach of the program to include the broader rural Middlesex County to reach as many TAY as possible. We further intend to extend the initiative to cover not only transportation for youth in crises, but also for those who would benefit from access to mental health services more broadly. So that would be including appointments and group sessions that would be difficult for these individuals to get to otherwise. If youth are able to access mental health services more regularly, the likelihood they will need to rely on this initiative when in crises will be substantially decreased. It is this type of proactive approach that we can anticipate meeting as the scope of the initiative is able to grow. And that concludes my presentation. Thank you for listening.